So it's time to get started with our psychoeducation on trauma. And for this, we need a little bit of a trigger warning or maybe a disclaimer statement. If you are going through these videos, and even though we're not discussing your specific trauma, you're feeling triggered and emotionally flooded, that's a great opportunity to either start working with a therapist or bring your experience back to your therapist to start working through that. So as we get started, the big question has to be is, what is trauma and what's going on with it right now? The term trauma is getting a lot of attention and perhaps even some overuse at times, and that's both good and bad. Trauma absolutely needs to be recognized. It needs to have some attention drawn to it so that we can definitely work on healing it, coming up with new strategies to treat it, and helping people move through it. But when it's getting overused or misapplied at times that it's not necessarily appropriate, it can actually feel like it's diminishing the value. And then, of course, there are people that are getting bothered by the fact that others are saying that something was traumatic. They're firing back with, not everything is traumatic. When you do that, that defensiveness actually diminishes the experience of the other person, and it can be equally upsetting for them. So, granted, not everything that is uncomfortable or upsetting is traumatic, but we do need to give some credence for the things that really are and understand that even if people are using incorrect terminology, there's something here that needs to be looked at and kind of considered, and we don't need to be insensitive to it and diminish other people's experiences. So when we get into what actually is trauma, it's really beneficial to start by looking at the medical model. In the medical model, trauma is an injury, and those injuries can be classified a wide variety of ways. So we can have small traumas, even a paper cut actually counts, to major traumas, something such as like multi-system trauma that you might see in a car accident. We can also classify the types of traumas that they are, such as blunt or penetrating trauma, or a laceration, a bruise, or a contusion. Things like this all are parts of classifying trauma. And we can classify them from mild to severe, as well as looking at the functional impact on the individual. So, for example, a minor trauma, like a paper cut, really only requires first aid treatment, and it's really not going to disrupt the person's day. But something that is far more severe, like a multi-system trauma, can have a significant impact on people. It can cause life-altering disabilities and even death. So when you think about that, trauma is a very broad term for a lot of things that can happen. When we move over to the mental health model, the definition, believe it or not, is not that far off from the medical model. Essentially, in the mental health world, a trauma is basically an injury. It's an injury to your mental health. And it can be minor or it can be very severe. And it can also have a functional impact on an individual. So perhaps a smaller event had some trauma to it that had some impact on you, whereas a bigger event might have been a more significant trauma that had a more significant impact. And individual factors play into this. What might be traumatizing for person A might not bother person B. What might impact person A significantly might not impact person B at all. So just because two people went through the same traumatic event doesn't mean that they're going to have the same functional impact, because there's other factors that are in play, such as resiliency factors that might help somebody cope with the trauma. So when we look at trauma and we're trying to really kind of get a picture of it, I think of it basically just an injury. So what is that injury? How big was it for you? And then what kind of functional impact did it give you that we're going to be trying to change going forward? As we start to look at trauma, we really need to have a basic understanding of some of the things that are going on in the brain, because sometimes people can think that mental health is a little disconnected from biological and physiological functions, but that's not true. A lot of our mental health is all going on in our brain, but beyond what we see on the surface of just cells. So let's take a look at this. The brain is composed of brain cells or neurological cells, basically a large network of them. And when they line up into specific pathways, we can see things like learned behavior happening. So, for example, if every time I touch a hot pot, I get burned, I'm going to learn not to touch the hot pot because my brain has created a neural pathway to say that when the stove is on, you don't touch the pot. The same is true with pretty much everything that we do. Everything that we learn, our learned behavior, has neural pathways being formed. So, what do I mean by a neural pathway? Let me give you an image. It's a hiking trail in your brain. It's basically a very specific path that has that information coded into it. So when we're trying to learn something new, we have to create a new neural pathway, or basically a new hiking trail in our brain. And if you've ever been hiking, you know that those new paths are not very well marked. They're overgrown with grass, they've got trees in the way, cobwebs in the way, and the first few times you start to hike them, you are breaking through all of this to start to create this new path. And over time, with many hikers, that path will be cleared of the tree branches in the way, it'll be cleared of the cobwebs, the grass will get matted down. And if you travel that pathway enough, it might actually be enough that you could then start to maybe pave it, eventually turn it into a road, that type of thing. But what happens to the old pathway? If no one's using it, nature reclaims it. And if you've ever seen nature reclaim an area, it's an absolutely amazing thing to see. You see those old abandoned houses, the grass grows, trees start growing, everything gets overgrown, and eventually the house breaks down and nature reclaims that area. The same is true with old hiking paths. Nature will reclaim that path. The grass will start to grow, the trees will grow over it again, and eventually you won't even know that there was a path there. So in our brain, we create the new neural pathway, and eventually our brain will prune and get rid of the old neural pathway that was there. So how do we see this happen when it comes to something like trauma? I'll give you an example. No kid is ever born with the fear of a car door or a car pulling into a particular driveway. They're afraid of loud noises, that's going to startle them. But they don't know anything about this car thing, they're an infant. But if every time the infant hears a car, what we know as a car pulling into the driveway, the sound of the car door closing, and then a parent coming in and being very loud and very scary, that child is going to learn to associate the sound of the car pulling into the driveway with a frightening experience. That neural pathway is now established. And as they go throughout their life, every time they hear that car pull into the driveway, they're going to have a physiological reaction to that sound because that neural pathway is established. In order to prune that old neural pathway, we have to create a new neural pathway to demonstrate that the sound of the car coming in the driveway is not a frightening experience, and it has to be reinforced many times before the old pathway is going to be reclaimed and pruned and go away. So when we start to look at trauma, it's usually not only just one incident with things like relational trauma or what a lot of people call complex trauma. It's a repeated event that's going on over and over again that's creating that pathway in the brain to say that this is danger. So that pathway stays. But then what happens with the rest of the body? Well, to kind of understand that, we need to take a look at some of the parts of the brain and how they're interacting and playing a role when it comes to trauma. As we really start to look at trauma and we start to understand all of it, we can look at it at the cellular level with those neural pathways, but we really need to take a look at what the brain is doing in the various sections. And I took my trauma course through Janina Fisher. She does a great program and explains it so well, and she's got resources for therapists to use with their trauma clients that I absolutely love. I have used it and I think it's phenomenal. But she really lays out what's actually happening in a brain. So in the back of your brain, for those of you who didn't study high school biology, don't worry. This is not going to be too difficult. In the back of your head, the brain back there is responsible for things like your heart rate, your respiratory rate, and basic biological functions. There's a part of your brain in the middle that they call the limbic system, which has a couple of different structures in it. And interestingly enough, when you look at these on like MRI scans, people who have been traumatized actually have differences in those brain structures compared to people who have not had to go through trauma. So we do know that trauma actually causes structural brain differences in these individuals. But that system inside the central part of your brain, the limbic system, Janina Fisher calls the emotional brain. This is the part that is responsible for your emotions, and especially the emotions related to danger and safety. Then in the front of your brain up here is your a logical brain, the prefrontal cortex, and this is what's responsible for your thinking. Interestingly enough, when she explains it and what they've done with brain scans, is what they're finding is that when somebody receives a danger cue, like looking at, let's say, a bear in front of you, apparently that did not scare me off from scaring the bear out of my garbage, but in any case, most people are going to have a fear reaction to that. That's going to engage the emotional brain and shut down the prefrontal cortex, and your brain is going to push you into what we all know as fight or flight mode. Now there's also freeze and fawn, but all of those are kind of tied in the same. When fear gets triggered, logical brain shuts off, emotional brain is on, and the part all the way in the back that's responsible for your biological functions is going to tell you you need to do something about this. Now, it can hyperactivate and it can go into that sympathetic response where we get an increase in heart rate, increase in respiratory rate, a decrease in digestion, pupils dilate, you get that dry mouth because you are preparing to either run for your life or fight for your life. Now, on the flip side of it, your body could totally deactivate and shut down, and you can go into that freeze or fawn response, that like play dead, and everything just kind of gets real still, real calm, shuts down. So you can have these two different reactions, this hyperactivation or this deactivation, based on your experiences. So when I'm looking at a bear, the normal response should be prefrontal cortex, logical brain shuts down, limbic system, emotional brain keys in to say that there's danger here, you need to do something about this, and go ahead and activate the primitive brain to have some sort of physiological response to respond to this danger that you're encountering. The thing is, for people who have had traumatic pasts, especially if you grew up in a house with, let's say, abuse, you've learned that even some of what would be normal relational behaviors is actually terrifying. It's a danger cue. And your body, your brain, is going to do the same exact thing. So when you think about that infant who started to learn that, the sound of the car pulling into the driveway was eventually very scary, and as they got older and they did what kids do and they're rambunctious, and that parent perhaps abused them, if they learned to associate the sound of that car pulling in the driveway with being abused, what's going to happen the next time a car pulls into the driveway? Prefrontal cortex, logical brain shuts down, emotional brain limbic system engages and cues the fact that there is danger and tells your primitive brain to do something. And you're going to have a physical reaction that you're going to feel in your body telling you to do something and to do something with it. So years later, when you're sitting at home and your partner pulls into the driveway and your heart starts racing and you can't comprehend why you would have this type of reaction, well, when we understand that a lot of times trauma lives and gets stuck in our body in sensations that we feel, we can understand that the sensation that I'm feeling is my heart racing because my partner's car has pulled into the driveway has nothing to do with my partner. It is a trigger. The sound of their car is a trigger that's causing me to feel something that now I need to learn a new response to. So that's just a little overview of how the brain actually assembles all of this and puts it together so we can understand why, when we get into therapy, the things that we're asking about when it comes to trauma is not what you've necessarily been through. How is it showing up now? What are the physical sensations in your body? What is triggering them? What is the intensity of it or the severity on it? 0 to 10, 10 being the absolute worst it's ever been. Where is it right now? How long did it last? What happened? What did you do coming out of it? What kind of strategies did you use to deal with that sensation? Now, once I have all of that information, I can start teaching you some new strategies to deal with those same triggers so that we can build a new neural pathway in your brain that chooses a different response. And eventually, over time, that new response will become the norm, and the old response will be pruned and will go away. So as we're getting ready to wrap up our discussion on trauma, one final thing I'm going to say is that there are many different ways you can assess whether or not someone has experienced trauma throughout their life. And one of the ways to do that is through measuring the adverse childhood events. And that's the one I actually used in my research study because of its simplicity. So the adverse child events were 10 events that the CDC felt had enough significance that it also had physical health correlates. So what they found is that as the number of adverse childhood events a person has experienced has gone up, we see more mental health concerns and we see more physical health concerns. So basically, if you have one adverse childhood event, which is pretty common, about 66% of the population has experienced that, and when you look at it, one of those items is your parents getting divorced. So when we have a divorce rate of 50%, it's pretty obvious to say like, hey, it's not a far stretch to say if 50% of the population is divorced and 66% have one event, it's pretty easy to grasp there. However, when we get to numbers of 4 or above, we see some very significant concerns that are coming up in people's mental health and their physical health. And on the mental health side of that, we're seeing a much higher risk of depression, suicidality, and anxiety. So when you think about this, a person who's experienced one adverse childhood event can have some health and some mental health issues. But when we get to 4, we're talking about significant mental health and physical health issues. When you get to people like me who are 7, my adverse childhood event number is 7, and you get to these higher numbers, it's really amazing to me how people like me are actually pretty well adjusted considering the things that we've been through. Now, in the therapy space, I don't necessarily need to know the specific details of the trauma that somebody went through to help them learn new responses to dealing with the traumatic responses that are reoccurring and are stuck in their body. But I do like to know what their adverse childhood event score is because it kind of gives me a picture of what we could potentially be dealing with and how I might want to set things up with my clients so this way they're getting the most out of the time that we are working together. So when it comes to adverse childhood events, these cover things like physical and emotional abuse, physical and emotional neglect. It covers childhood sexual abuse. It covers parental separation items through things like divorce or incarceration. Even though parental death or termination of parental rights isn't included specifically, I kind of throw it in there when I'm talking to people because losing a parent through abandonment like that, it can really be very devastating for people. And this also covers things like whether or not a parent in the household had a substance use disorder or if they had a mental health issue. So all of these factors are combined. And for research purposes, using the adverse childhood events to measure or as a measure of trauma was a nice, easy way to do it for a study that needed to have a very limited focus and a very small time frame to be able to collect data. So I was able to use that for my study, and I will talk about that when I do get to finally talk about my research study. But there are so many different ways to assess childhood trauma, and the adverse childhood events doesn't even include things like poverty, low socioeconomic status, which we know affects people significantly. It doesn't include things like war or geographical issues or things like September 11th or COVID, these major events that we know have had impacts on people. So the adverse childhood event score isn't all inclusive. It's just one way to measure adverse childhood events, but it is not the only one, and it is not inclusive of everything that's out there. So it's always a good idea when you're looking at different assessments to kind of realize that no assessment's going to be perfect, and no assessment's going to capture everything, because people, all of us, are unique in our experiences. So usually your best assessment is having a conversation. But again, I don't need to know about the specifics of your trauma unless you want to share them with me, because walking back through your trauma can re-traumatize you. What I want to know is how that past trauma is actually showing up in your present life and affecting you today. So hopefully this information helped you out, and you're going to stick around for the trauma series. I'm planning on 5 trauma videos, and as always, if you are feeling triggered or flooded by anything that's being discussed today, then it's really a good idea to start working with a therapist. And if you are working with a therapist, take your experiences of what you're feeling in relationship to what you're hearing and bring them back to your therapist so you can work on those things in the present. Good luck.